We started back in 2000. We had an opportunity to open up this practice about 3.5 years ago, and it was, my understanding, it's the largest optometry office in the state. Well, I like to say we bring our A game every single day. We try to really make a good effort to make a difference in the patients' lives. And to that end, we worked through the entire pandemic. We never closed because we realized that seeing clearly is it's just not a luxury. It's a necessity. And especially in these days when people are looking at their screens and reading, they're not doing their normal routines, our services are more important than ever. Well, we just tried to adjust as best we could and just use a little common sense. And our staff is just so good. They've always been cleaning. This is nothing new for them. But they took it to a whole nother level, and every time the patient touches a pair of frames or eyeglasses, it goes in to get cleaned immediately thereafter. If the patient touches the chair, that gets cleaned and wiped down right after. The masks and the gloves, that took some getting used to, but everyone's in the groove now. We all understand what it's about. The scope of services we offer is just beyond compare. That's why we routinely get patients from all over the country. We get the complicated eye health and vision problems, and that's what we've been doing for decades. There's 600 eye doctors in the state of Nevada. There's one low vision therapist in the whole state, that's being Sandy, here in this office. Because when a doctor tells the patient, "I'm so sorry, there's nothing more we can do," and you've heard that from a number of different doctors, depression sets in, and you despair, and you start to search for services above and beyond what you've had in the past. And they usually find us sooner or later. Now, once I identify how to help, I like to say what shoe to fit, then Sandy teaches them how to use these vision aids. Because remember, these patients may not have seen a loved one's face for the last 10 years, or read a menu for that matter, or their mail. And Sandy will show them conclusively how they can regain their independence to read again and see a loved one's face. It's kind of a Kleenex moment for most of us. If I couldn't do this alone, without the vision therapist to train the patient how to walk safely with a white cane or to use these vision aids to read again, and our staff which builds these very complicated lens systems, it really is a team effort that's quite unique in the country.